Staying healthy, staying sexy, staying young is what living life is all about. And if you have doctors that have proven treatments that keep people young and healthy so they don't get sick, you want people to know about these treatments and that they exist.
PSA testing is outdated. You're going to learn that and so much more from Dr. Omar Durrani, a urologist from Houston, Texas, that believes preventative health is the way to go. This episode is brought to you by GainsWave. GainsWave is a treatment done at your doctor's office to optimize erection quality without the need of Viagra, Cialis. It's non-surgical, there's no needles, and it has an amazing success rate. To find a GainsWave provider, go to gainswave.com. That's GAINSWAVE.com. Hello, this is Mark L. White with Health Hacks, and I am so honored to have Dr. Omar Durrani, really good second-generation urologist, right?
That's right. That's right.
From Houston, Texas.
That's right. Exactly.
So that must have been interesting growing up, having a father who's a urologist. Did you always want to be a urologist when you were younger?
You know, I always liked the fact that he enjoyed his job and people respected him. I could be with any surgical specialty in the course of med school, and I landed in urology after looking at the other specialties. Actually, ENT was close. But believe it or not, I think you'll find this funny. I couldn't look in people's noses and ears all day, so I chose urology.
Much better than proctology, I guess.
That's right, exactly, or GI. So
or GI.
Yeah. But the urologists that I met in school and training were fun-loving people, good sense of humor. We do a variety of things classically, and then we specialized later on. So I think I picked a good field.
Any funny stories from med school?
You know, looking back, I think what drew me to the field was breaking up kidney stones with the laser, things like that. We all, I think all docs have stories of retained foreign objects or retained foreign bodies in places where they shouldn't be, including the urethra, the rectum. Not so much urologic related, but yeah, nothing I can say on air.
Don't worry, you could say anything you want on air, but I don't want to ask what you've pulled out of people's rectums.
Not personally. Been present. I'll tell you off air one day.
Okay, fair enough. So you decided you wanted to be a urologist, and one of the things at Health Hacks that we talk about are ways to keep people from getting sick, because we believe that doctors should be about keeping people healthy and treating the root cause of disease. Do you find that in urology, it seems to be there's two types of urologists out there. There's people that love treating symptoms, and there's other people that like keeping people healthy.
Mm-hmm. Right. Yeah, I this is where I wanted to go with this today, Mark, is that, I feel like in the last year or two, I've had a paradigm shift in the office where, of course, I'm still interested in looking for the source of microscopic blood in somebody's urine, because it could be something easy or benign like a stone or a cancer. But I think that I've watched a couple of these episodes on YouTube, and I think you're doing a wonderful job, you and Rusty, about raising awareness of health overall, and the way that modern medicine is not taking care of people's health the way we really should be. This morning I was listening on the radio on NPR. They said that the death rates for men ages, I think 25 to 65, working age men, and of course I'm not trying to offend the people past 65 still working, but are going up in the United States, and that other civilized countries in this world have either stable or improving death rates. And the question is why? And the answer is, according to this expert in epidemiology and public health, that it may be the drug crisis problem for younger guys. He said the worst was in the Rust Belt in Ohio, in that area. But I have to think that we're not doing a good job in disease prevention. And there's far too many obese people that are trying their best. Many of them are trying to eat well and exercise, but the food industry is against them. watching hours and hours of TV, looking at these conspiracy theories is something that all of us can do, but there's truth to it, right, Mark? I mean, don't you feel like?
There's truth, but I guess my question is, why is the U.S. different? Because you're talking about how other countries,
yeah, that's a good question.
The death rates are going down. Why are death rates going up?
So I'm no specialist in this, but I think that everyone is to blame. Partly the physicians that are prescribing statins and anti-diabetic drugs without time allowed in this country for us to spend with the patient to talk about the diet and exercise. We all get about 20 minutes per patient, and I think it's easier for us to talk very superficially about diet and exercise, but then at the end of the day, prescribe the medications and order the lab tests. And maybe in other countries, they have more time to spend with their patient.
How long have you been practicing urology?
About 15 years now, 14 to 15 years.
Have you noticed in your own practice a trend, like guys are coming in more obese, guys are having more problems?
Oh, absolutely. I mean, we could spend a great bit of time just talking about what our average patient typically looks and how they look and feel. But I see a lot more men than women in the standard urology practice. And these men are,
so.
Yeah, well, I'm not a female urology specialist, but I do my share. The men are working hard. They're trying to take care of their family. They're stressed. They're not getting enough sleep. They are eating the same foods that many of my other patients are eating that are high in sugar and processed foods and whatnot. And their testosterone levels are declining. And I think that, that's an area for discussion. You guys have talked a lot on your show about that. But we're just, myself included, we just don't have the time to devote to diet and exercise the way we should. Does that make sense?
No, I mean, I think educating people is definitely the key to changing patterns out there. But as a urologist, I guess the first 10 years, I assume you're primarily insurance-based.
Correct, yes.
So why do guys go to see a urologist? Is it because something's broken, or should people be checking in with a urologist when they hit 50, 60?
Right. Good question. So yes, I think the short answer to when to be screened for prostate cancer is one of the main things that we do. Depends on your family history and race, actually. So African-American men should start somewhere in their 40s with a baseline blood test and a prostate exam. Men with no family history, Caucasian men, for example, with no family history of prostate cancer can start at age 55 to 69 is what they say the peak age for screening is. But a baseline blood test is often drawn by the primary care physician somewhere in the 40s, early 50s, and there's no problem with that. We see a lot of patients younger than those 40s, 50-year-olds with prostatitis or infections or pain or need for circumcision, kidney stones, all those kinds of things, vasectomies.
One thing that I think that's interesting is how many false positives come in with PSA test, which is your prostate-specific androgens.
Sure. Yeah, so I think a public service announcement is that, for all the audience out there, is that PSA testing is being debated hotly by the U.S. Preventative Services Task Force and our American Urologic Association and people across the world. The bottom line is that we have probably over-tested and over-diagnosed prostate cancers in the past, and that the pendulum is swinging in the direction of being a little bit more discriminatory about who we test, so those age ranges, and then not relying solely on the PSA blood test for further workup, so a biopsy, for example. We have, thankfully, nowadays, I think in my practice, at least, and in many people's, we have a newer blood test called a 4K score, and other people use something called a PHI index, but it's a blood test that can better tell us the risk of cancer. And then after that, we have an MRI of the prostate that can tell us if there's any areas of suspicion before you do a biopsy. So we avoid unnecessary pain and risk of infection and bleeding. And then with cancer diagnosis, I think 10, 20 years ago, if a patient got a diagnosis of prostate cancer, even if it was low grade, as we say, they would be interested in surgical or radiation treatment. now we're watching some of those cancers, and we're more and more comfortable, and patients are more comfortable just watching them because we know that the natural history is that those won't progress. So not all cancers are the same. No one needs to go straight to a biopsy. Oftentimes we have the better blood test and the MRI beforehand. So don't be as afraid of it.
So what you're saying, so it's like the treatment of the cancer is actually worse than a low-grade cancer itself.
Correct. And people, large-scale epidemiologic studies are showing that patients who are on active surveillance will die of other conditions before they die of prostate cancer. So I think for all of you watching, if you get a high PSA, go to your doctor. Hopefully they're conservative and they'll retest it. They'll treat with antibiotics if there's an infection. They'll get a 4K score, a PHI, an MRI, and then a biopsy instead of straight to biopsy.
What scares a lot of guys is the digital rectal exam.
Yeah, right, exactly.
Is that done before the PSA, after the PSA, or is that something that's not even done anymore?
Yeah, I think the day will come when it's not even done unless the PSA is abnormal. But right now, we still recommend the combination. Studies have shown that it doesn't really significantly change the results of the PSA blood test. So you could do an exam first and then the blood test second. If I have an opportunity, I'll do the blood test first in my office. And I try to talk. I talk a lot, so I try to talk, and then just don't give them too much time to think about the exam. I'll just get up and show them kind of how I do it, and then it's done before they know it.
Tell them to breathe, relax.
Yeah, exactly. Because if you give them too much time, they'll ask if they can pass on it, and sometimes I let them pass, but we should do it.
Got it. Is there a way to prevent prostate cancer? Are there any risk factors, anything that you're seeing out there to make it a preventable disease?
Yeah, it's a good question. The answer is that what we're finding is that heart healthy is prostate healthy. So to make it simple for people, diets that are rich in fruits and vegetables, and sparing on processed foods, especially processed meats like bologna and sausage and things like that, is the right way to go, so to speak. And also watching your weight. Obesity has been linked to higher risk of prostate cancer. Getting adequate vitamin D exposure, so sunlight exposure or vitamin D replacement, can help protect against prostate cancer. And then on a more microscopic level, it's the things that we find in fruits and vegetables that have been shown to lower the risk of prostate cancer. So for the patients out there, if you are watching your diet, staying active, getting sunlight, or taking a vitamin D replacement, avoiding getting obese if possible, all of those things are good to prevent prostate cancer so far.
And I know one of the things you've done very well, I've heard, is that you've transitioned a lot of your practice to preventative healthcare.
I'm trying to, Mark. I don't know if you've ever heard of Dr. Mark Hyman.
I have.
Yeah. Have you ever had the chance to speak to him at all?
Informally.
Informally, yeah.
Informally.
So I don't think there's enough time in my day right now to dedicate to studying for a functional medicine certification. But I really have enjoyed watching and reading his books and watching his YouTube videos. And for all of those who don't know Mark Hyman, he's a functional medicine expert who is at the Cleveland Clinic. He's the head of their Functional Medicine Institute. He himself was a primary care physician who was doing special diets before there were diets. He's been through all the different kinds of diets himself. And he believes in the whole wellness picture and how that can really help make our society healthier than traditional medicine, or combined with traditional medicine.
Yeah, I think what you see with functional medicine and age management practitioners is by using your special skills of wanting to help people to keep them from getting sick as opposed to treating the symptoms.
That's right, exactly. So if I could someday get certified, that'd be great. Right now, I'm just superficially talking about these things with my patients, but we have only a few things on our coffee table outside, and two of them are books written by Mark Hyman. I think if people are sitting there waiting to see me, hopefully for not too long, but that's what I offer up for them to read instead of our past National Geographic and things like that. So,
how about optimizing hormones? I know you do a lot of testosterone replacement therapy. When should a guy take testosterone?
So my brief background, in case my colleagues are watching, is that I had to teach myself about testosterone replacement. We didn't learn it in residency. All credit to my bosses up in Boston. We were surgeons before testosterone experts. And so anyway, long story short, what I've learned is that men, to answer your question, if there's complaining of decreased libido, 35 is the right answer, I would think. After 35 years of age, the level starts to decline by about 5% per year. And what we find is that older people tend to have lower levels. You know this, Mark. Mm-hmm. And but it's really the acquisition of medical illnesses that drags the testosterone level down. So if the man is lean and fit and exercising, his levels might be still pretty well preserved. But most of us guys will have high blood pressure, high cholesterol, not as active as we should be, and it all starts to happen around 35. And you know, it's symptom dependent. You know, not everybody needs to be screened. In other words, I think to keep with the guidelines, if you're having decreased libido, loss of energy, trouble losing weight, depression, or irritability, then it's worth getting checked out.
It's amazing. I've worked with a lot of urologists in the last 2 years, and it seems like there's a dichotomy. There's urologists like yourself that are very progressive when it comes to things like testosterone replacement therapy, healthy lifestyles, integrative wellness.
Right.
But the urology community as a whole seems to be more conservative. Yeah,
very much so. I think that even if you go to, hopefully it's changed, but as of a couple of years ago, if you go to a lecture at the American Urologic Association on testosterone replacement and what do we know now, it's a basic science lecture on hormone biology, and not the pearls that at least I went there for. And, you know, I know that the guys that are big in the field, Dr. Morgenthaler, Dr. Moet Kara, others such Dr. Wayne Hellstrom, these guys are superstars in their fields. You probably know these names.
I do.
They, I don't think it's that they don't want to release the pearls that they've learned over the years. I just think that they're trying to stay so conservative in front of the mic, in front of the podium. And it's too late for that, Mark. I think that if we don't do enough, this is my plea to those guys out there, write a book, write some journal articles on pearls of wisdom, that if you don't do enough now, we're going to be bypassed by the low T centers and by the endocrinologists. I don't think the endocrinologists are any better than urologists. They're very conservative too. But patients need this advice. And I don't know about the rest of the doctors out there, but they're coming to ask me questions that are quite sophisticated about the various types of hormone replacement. And I can say that we don't formally know the answers to their questions. You have to dig it out from other sources, and that's a real shame. I know maybe some people are trying to work on this to educate the public, but I view it as a real shame.
Well, even with technology such as GainsWave, the urologists should have been all over it because the studies have been around now for over a decade. And I know that there's plenty of urologists like yourself that are offering it, but it's surprising that it hasn't been embraced by 100% of the community.
Yeah. So I'll tell you about Houston because I know a little bit more about Houston than the rest of the country. But with all due respect to my colleagues in the bigger groups, I think what might be happening is, I haven't been inside the large groups, but there may be a couple of naysayers and then a couple of people who are interested. And the people who are interested probably have seen all the journal articles saying that there is some credence to this, especially in the right population. And the naysayers are probably older and don't want to risk the reputation of their practice. And it doesn't happen. Does that make sense? So the private guys like me, there's only a few here in Houston, are more willing or able to think outside the box. So, but don't you think that's changing? Because they're doing a lot of good basic science research, and everything that I read on shockwave therapy is showing that it's capable of helping a significant portion of the population.
I think what's changing, and I think you kind of hinted on this before, is that the consumer, the patient's getting information directly from the source without having the doctor as a filter.
Sure. Exactly. Yeah.
Then when the patient asks for something, then the urologist or whomever, the provider, researches it and finds out if it works or not.
That's right. That's right.
And I know you've been doing GainsWave now for about 2 years.
That's correct. Yeah. And I'm honest with all patients. I tell them that this is the literature. These are the studies from GainsWave. These are the studies that we found in addition to that. And I tell them that for the diabetics out there, the people with severe ED, I tell them that it's not as likely to work, but it's worth a try, especially if it's a difference between the other alternatives of the vacuum erection device, the penile injection therapy, the surgery. We go over the pros and cons, and for some it's a cost issue, and I get that. Other people, they're willing to do whatever it takes to avoid going down the path of surgical involvement. And really, even those patients with severe ED will see more sensation. They might see at least a temporary improvement in their erections, and you never know. That's the thing. I think that I don't know what your stats are in terms of what you've seen, but maybe 60% of those people will respond, and not 80%. And then it's a question of how long and will it last, and what's the right recipe. So GainsWave has done a good job. I think that the leaders in the industry know GainsWave, the name, and that's a good thing. And it's up to me and our other colleagues to push that forward. Does it make sense?
No, I think it's great having progressive providers, urologists to stand behind it.
Yeah.
One of the things you're seeing, or we hear a lot of, are younger people with ED. And when I say younger people, guys in their 20s and 30s.
Sure.
What do you think's behind that?
So I look at our guidelines in urology, and they say that you should always try to weed out how much of this is psychological in the young people. And I work closely with one of our sexual health counselors in the city that has a lot of experience in helping those men with performance anxiety. But my next question, Mark, is whether, in my head at least, I'll find a polite way to ask it, is whether they've been smoking cigarettes or not. If they've had cigarette exposure, that accelerates atherosclerosis, late 20s, early 30s, that can happen. Diabetics, of course. And the other part of it is testosterone levels. Of course, we want to check that. But yeah, about 10-20% of men in their 20s will have ED. And then I've seen you talk about this in the other shows, but the porn industry is not helping young guys who are perhaps addicted to porn, because it takes a lot more stimulation to get to have an erection. So that could be another factor.
And things like PDI5 inhibitors and GainsWave, does that help people with that are younger, or is it something that really they should be seeing a psychologist about? My basic thought there is that PDE5 inhibitors can help force the situation. So if it's partly mental, and I don't say that in a bad way, but if it's partly performance anxiety, I think you can see some enhanced blood flow to the penis that gives them the confidence back. And then I tell those young guys that they can wean off the medication if it's starting to work again, so to speak. So you can use them hand in hand. You don't have to just do counseling. So if you had a crystal ball and you could predict over the next 5 to 10 years, what's going to be the biggest thing that's going to change your practice, or what's going to be the biggest health hack that we can expect?
Yeah, Mark, I think it's going to be an increased focus on the fact that nutrition is medicine. I'd love to see that. I'd love to see that. I don't think it's going to be five years. You probably don't think so either, but 10 years, let's hope that people get it. That there's just an uproar in the community that we're being fed way too much sugar for our diets, right? And I'm not proposing a vegan diet, but I think that there's probably a low-fat fish and salmon and that kind of diet. That's the best way to go. So diet is going to play a big role in the health of our patients, because you already see the studies that are linking obesity and high-fat diets to prostate cancer and prostate enlargement and things, and low testosterone and whatnot. What else is going to change? I think we're increasingly aware of the effects that smoking can have on urologic health and cancers. I don't know if the lay public knows just that bladder cancer and kidney cancer can occur with smoking too.
But it's funny because you're mentioning smoking, and then the vaping industry comes out, and people that would have smoked are vaping. So smoking's at an all-time low, and now it's coming out that vaping is actually harmful. So
That's right.
What do we do?
We all know what to do theoretically. You and I know we should eat healthy and exercise and keep active, but I don't think that it's either easy or possible for some men to do that. And so I think testosterone replacement will have an increased awareness. It already does. What else was I going to tell you? Vitamins and minerals and micronutrients, that goes back and forth. I think the studies show that that the vast majority of multivitamins probably don't have any particular benefit, but they're still studying vitamin D and omega-3 fatty acids and things like that. So that will help, right? Disease prevention is going to be the next focus. Mark, don't you think the millennials are doing a better job of focusing on disease prevention than Generation Xers or the rest of us?
100%, absolutely. And I think it's because they don't trust experts.
Yeah.
I mean, when we grew up, we were taught to trust doctors, and we were taught to trust the media, and we were taught to trust any authority figure. I think millennials in general are more suspicious.
Yeah, I agree. And I think what I'm finding out at this age, at 45, and I've only been in practice for 15 years. It's my colleagues many, many more years, but there's a limit to what medicine can do. There's a limit to what we know. I mean, I see prostatitis every day in my office, and I'm telling these guys that we don't know exactly what causes that or how best to treat it. There's limits to what we know about testosterone replacement or what causes prostate enlargement. So I think that medicine has many limitations, and hopefully regenerative medicine has a place in the future. I know it does. Functional medicine does. That's the shift, at least in my practice.
I agree. And I think you're going to see that more in urological practices, especially with what we're seeing with stem cells, platelet-rich plasma. I know that both stem cells and PRP is controversial in the penis. Are you doing any of those treatments at all?
I do. I was an early adopter and always looking at the data and telling my patients that for PRP, we tell patients it's like fertilizer on the area that has been treated with low-intensity shockwave therapy. So theoretically, it must have some support in urology as it does in other disciplines. Stem cell therapy has some studies that they really hit it out of the park when it comes to patients who've had prostate cancer and were able to have intercourse where the medications were not working before. But I think that it's important for the public to understand that as you know, that we're still accruing the data. It's not that we shouldn't do it, but the patients should be informed that we don't know everything we need to know about it. It doesn't bar you from getting it, and to know all of the options. Talking to a urologist, you're always going to get our urology answer, which is conservative by nature. And many of the guys that I talk to who are given all the options will still choose to undergo stem cell therapy or PRP.
I think that's the most important thing, and that's what the podcast is about. That's what why it's important for guys like you to speak out. It's important for people to get the facts. It's important to people like there's two sides to everything.
I agree.
If somebody wants to get in touch with you, what's the best way for them to do it?
They can go on our website. It's Durrani, DURRANIMD.com. I don't know if there's a glare on that TV, but that's our logo and website. They can also call. So I call it a boutique urology office because it's just one provider, and all of my staff are kind of in a line in the office. So we have a receptionist, the waiting window, and then a long desk, and then 2 or 3 of my MAs and me. So I can just call 281-589-7175, and I'll probably overhear the phone call, things like that. So
I think the boutique urology practices that I see out there are doing the most good for people. It's great to have you as part of this. It's great to have you as part of the movement. Thank you so much for your time. I really appreciate it.
Thanks, Mark. Is it 30 minutes already? That went fast.
I can talk for another 30 minutes.
No.
For another hour, but I know you have you told me you had a patient.
Yeah, exactly. We're trying to figure out what imaging studies order. Mark, I just want to say thank you for all the work that you do, for informing the public. I believe in these podcasts. I think that we need to spread the word out there that there are limitations to what we know in modern medicine, and regenerative medicine has a role in the future. So good, strong work. Yeah.
I appreciate it. I think there's many more great things to come, and I would love to have you participate in anything we can do to inform the public. Thank you so much, Doctor.
Thank you. Have a good day, guys.
Take care.